preserve. You know what, Becky? I think it should be long. I think
I can't, really?
oh, I don't know. Just as far as how the video.
I think it'll be better this way.
Looks pretty good.
Okay.
Yeah, we'll see what happens.
All right, and then I put on there, the title is Brain Health from a Primary Care Perspective. Just so you guys know, I'm not a neurologist. I'm not an expert in brain health and things like that, but this is going to be kind of from a family practitioner, primary care perspective is how we approach patients' brain health. So, just for some definitions, there are lots of words that get thrown around whenever we're talking about memory and memory loss. Dementia, so here's kind of a long definition. Acquired disorder that's characterized by a decline in cognition involving one or more cognitive domains. And so acquired, meaning it's something that happens to us. Typically it's not something that is genetic or that we are born with, but it develops over time. A decline in cognition, kind of how our brain functions. And then in one or more of these domains. So most of the time whenever we think of dementia, we think of memory loss, just for being forgetful, not remembering things, but that's just one of these different ones that they list here. Learning and memory, language oftentimes is something just for how to communicate, executive function, how to do things, you know. For those of you who still balance your checkbook, that's always a good example that we've used. Remembering how to balance your checkbook. Things that you used to do all the time. If you cook and you have a recipe that you've always followed, all of a sudden you can't remember how to do that, that's executive function. Complex attention, just remembering, paying attention to different things. Perceptual motor, some of that is balance. Being able to know your brain, to be able to know which way is up and down, and how to keep your balance whenever we're moving. And then social cognition, you know, just social norms, how to get along with other people, how to interact with people in different situations. So really just one or more of these, a decline in the ability to be able to perform some of these functions would be the definition of dementia. Mild cognitive impairment is basically mild dementia. So this is usually what people will start noticing. Most of the time when people start developing what we define as dementia here, it's a little bit more obvious. You know, most people have already known, there's already been issues that have been coming up. Sometimes people are already being treated for it. But the mild cognitive impairment sometimes is something that people might not notice as much, especially if you're around them all the time. And then a lot of times the person who's suffering from it can trick people. One, because they're smart, and then they can use their kind of brilliance or their knowledge or just other things to try to hide some of these impairments. Or if they've just been in the situation, this circumstance or the environment for a long time, they just know how to manage it just from how they've always done those things. So this intermediate state between normal cognition and dementia, where there are some impairments, but no overall decline in function. So they're still able to do lots of things, but maybe not as well as they could be, or they have been for a long time. Any questions about those?
Can one remain in that state, or do you continue to do
They can. I mean, a lot of it depends on what's causing it. So that's what we'll go into next, kind of different etiologies, different disease processes that cause these. So if it is a progressive disease, then typically it will progress. If it's something that just kind of happened, an insult to your brain, and it doesn't continue to insult your brain, then it could stop at that point and not continue to get worse. So,
I would think all of us
I agree.
would be would be in one of those in dementia. I mean, complex attention or forgetting people's names.
So I have a handout that I'm going to give out that I just remembered to print out, that's printing right now. And then in a second, I'll pass that out. I didn't want to pass it out at first because then you all y'all wouldn't be listening to me, you'll just be reading that. So we'll hand that out and it'll give an example of that, of kind of what's normal, expected, and then what's
Okay.
abnormal to be a little bit more concerned about. But really good question.
Well, and more what's changed with us, right? That what our normal was compared to how we are now.
Yeah. So I think a big thing to look at is this level of function. So obviously our brains at 70 aren't going to be the same as they were when we were 20, you know, and not just our brains, but our bodies kind of responding to our brains too. So I think that overall level of function is a big key to that, because even if you can't remember things as well, did I print enough? Yeah. Even if we can't remember as well as we did before, are we still managing okay? Obviously, with that level of function, what we worry about is harming yourself or someone harming themselves. If they get to the point where they can't, you know, the perceptual motor is so off that they're falling all the time, then obviously we need to intervene and do something at that point.
Or leave the gas on the stove.
Exactly,
Uh-huh.
yes. All right. So types of dementia. So there are a lot of types of dementia. And a lot of times this is what kind of gets a little confusing, because a lot of times people will use Alzheimer's and dementia interchangeably, thinking it's the same thing. It makes sense to do that. The most common type of dementia is Alzheimer's. Probably 60 to 80% of different types of dementia is Alzheimer's dementia. But there are a lot of these other ones. Here's Alzheimer's, dementia with Lewy bodies. Some people have heard that before. Frontotemporal lobe dementia. A lot of times that can have a lot of kind of balance issues too. Parkinson's obviously has a lot of balance issue. That's more of a movement disorder that can develop dementia as well. Those are real common ones, and then there's these other not as common, supranuclear palsy, corticobasal degeneration, multisystem atrophy, Huntington's disease. We don't see Huntington's disease very often, but it's a really bad disease if you do see it. It's a movement disorder similar to Parkinson's, but sometimes I think, so my dad had Parkinson's and he did develop dementia, and I think both with Huntington's and Parkinson's, because their brain kind of is being taken over by this movement, these uncontrollable movements, the dementia almost is merciful on them. And on my dad, I felt like it was mercy on him, that he didn't know, he wasn't aware that, because he was a surgeon too, he wasn't aware that he couldn't do the things that he always had been and been very successful at. And so that dementia kind of helped him not be so aware of what you can't do, yeah. So, and then there's some non-neurodegenerative. So these are all neurodegenerative. These are all nerve problems in our brain that will cause the dementia. There are some non-neurodegenerative dementias that can be reversible. So this is one, Hayes, that kind of what you're asking about, progress or slowed or halted. And then vascular dementia. Vascular dementia is something that sometimes we don't think about. Basically, anyone who has kind of a problem with their vasculature, so they've had a heart attack, they have high cholesterol, they have what's called atherosclerotic cardiovascular disease, just build up in somewhere in the blood vessels. If you have that buildup in your heart or your legs or your carotid arteries, most likely you have it in your brain too. And so with that vascular dementia, it's like over time, small parts of your brain slowly don't get good blood flow, and they get kind of knocked off, and the little part here doesn't get good blood flow. And so it is more insidious. It's kind of a slow onset of parts of their brain not working as well. And so it sometimes is something that just is so gradual, people don't notice it as much.
Can you take care of anything for that?
You can. So if you, just like you're treating your heart disease, if you exercise, change your diet, control your blood pressure or diabetes or cholesterol, whatever is causing that vascular disease, that can definitely slow or halt that disease. Now, what's been affected already might not regenerate. The brain doesn't regenerate as well as the heart does, but sometimes some of that can be reversed or at least slowed.
statins, do they help in a situation like that?
They can. I mean, again, they can cause problems. Any treatments can cause harm as well as good. The goal of the statin to try to help, decrease the inflammation in the blood vessels, so things aren't so sticky and they don't develop clots in our arteries. But then there's some, not really evidence, but some thought that maybe statins could be problematic too. So, but for the most part, if we're trying to treat that vascular disease, it should help with the vascular dementias too. But things like aspirin definitely will be helpful for that. So presentation. So here's where the worksheet is. So it was interesting, and as I was reading and preparing for this, they said self-reported memory loss does not appear to correlate with the subsequent development of dementia. So I think that's really important because I tell this to people often. A lot of times when people come to me and they're worried that they're developing dementia, it makes me less concerned because they're aware themselves that they're developing that memory loss. So it usually is the informant-reported memory loss that's a much better predictor of current, present, or future development of dementia. So that self-reported memory loss we're not good, accurate judges of ourselves and how our memory is doing. We're always going to be harder on ourselves. We're always going to think, I should be able to do this, but if you ask the person who's with you a lot and they're saying, you're not remembering, then they're a better judge of that, either memory loss or gradual development, future development of the dementia.
If I can just take a second to report to the rest of you, I was having problems feeling like my memory was declining. And I came in and I asked Dr. Imperial, and he gave me a couple of tests to determine whether that was right or not. And he said, well, maybe slightly, but you are still, in terms of dementia, you don't have it. You might have a little bit of, I'm 81 years old, so something's going to decline anyway. But it really helped me, assisted me a lot to be a little more calm about it. I was getting frightened. And it took some guts to go see Dr. Imperial and ask him the question, because you're embarrassed by it. And he ran me through a couple of the tests and determined that my problem, I'm not going to remember all the things I remembered when I was 30, but my problem, I didn't have, compared to something to be worried about, I didn't have a problem. I encourage, now we're going to fill up this calendar, because I encourage you, if you're having those kind of feelings, to go talk to Dr. Imperial about it.
Yeah, and we can do that. We'll do that same test. I think it's a good one that we'll do in series.
Made me feel a lot better.
Good. So this is the handout that you guys have, the 10 warning signs of Alzheimer's, how to identify and address concerns. And it says over 55 million people worldwide are living with dementia, including more than 6 million.
She's
6 million.
recopying because it was a 2-page handout.
Yes,
She
I
copied
think
it,
it was
so
ours.
Oh.
some of them only had the second page.
Yeah, I
No.
think it ended up being 4
It's 2
pages.
pages.
Oh.
It's 4 pages.
Oh, it's
I
3
think-
pages.
2 sheets.
Oh, yeah, it's 4 pages, it's 2 sheets.
Yeah.
2 sheets on front
So
and
this
back.
is a
Sheets.
full
So
one.
some has front, some has.
Who has the front? Who has the first page?
10 warning signs.
So we'll get you.
Raise your hand for the whole thing.
We'll get everyone who wants a handout before we leave here, or we'll give you your money back. So the other interesting thing, it's about different things that I looked at. Probably $8 to $10 billion industry. This memory loss and dementia. That probably includes the nursing homes and home health and different things like that too. But there's a lot of money that's going into our memory.
I want some of them.
Okay, this wasn't the worksheet, but this will do the same thing. So number one, memory loss that disrupts daily life. So again, there's memory loss, and then there's memory loss that disrupts daily life. So again, it's that function that is really the key there. So common forgetting recently learned information, forgetting important dates, events, asking the same questions repeatedly, increasingly needing to rely on memory aids. And then here, what is typical of age-related change? Sometimes forgetting names or appointments, but remembering them later. So that's kind of a difference between the memory as far as what would be more concerning or needing to look into, and what would maybe be just typical age-related changes in our brain. So number two, challenges in planning or solving problems. The ability to develop or follow a plan or work with numbers, familiar recipe or keeping track of monthly bills, may have difficulty concentrating and taking much longer to do things than they did before. And then typical age-related changes, making occasional errors when managing finances or household bills. But it's not a pattern, it's not something that's happening all the time. But again, as we go through these, you could see how it would be the difference between someone self-reporting and then an informant reporting with these errors and problems.
I need the front page.
She needs the front page, and I need the second page.
Got all these front pages right now.
So difficulty completing familiar tasks. People with Alzheimer's often find it hard to complete routine tasks, sometimes driving to familiar locations. So you guys all made it here okay? Organizing a grocery list or remembering the rules of a favorite game. And then typical age-related change, occasionally needing help to use microwave settings or record a TV show. Or program your VCR, if anyone still has a VCR. Confusion with time or place. People can lose track of dates, seasons, passage of time, may have trouble understanding something that is not happening immediately, may forget where they are, how they got there. Age-related, getting confused about the day of the week, but figuring out later. One thing that's real common, especially people who've worked their whole life and all of a sudden they haven't worked for a while, getting out of that routine of waking up at 6 o'clock in the morning, being at work at a certain time, coming home at a certain time, going to work from Monday to Friday and having weekends. And then now when you're retired, there's no difference between Monday and Saturday, you lose track. You don't remember what day of the week is because you're not keeping track of that all the time. So that's not as worrisome. Now, if you don't remember that it's Sunday and you went to church that day, that might be a little bit more concerning or something to kind of look into.
Doctor, but why is it, what would you call it? I can remember what I did when I was 7 years old, 80 years ago. But I can't remember what I was doing yesterday. Is that bad or good or?
No, it's not good or bad. It is. Typically our short-term memory is going to go. We're not going to hold on to things as closely in our memory. Especially if it didn't mean a whole lot, like whether you had spaghetti or peanut butter and jelly yesterday, doesn't really mean a lot to you. Right, you're not. It's just something that happened. But when you remember that you won your Little League baseball game because you hit the home run, that's
right.
never going to leave your brain.
Mm-hmm.
And when that leaves your brain, then we'll be concerned about that. But if there's nothing to hold on to it in your memory, then it's just not important.
Okay, thank you.
Can I had chemo a while back and had all sorts of bad reactions, but part of it was heart damage, and I had a lot of trouble thinking. I still have trouble thinking. I just give up a lot of times, but I think it's just, and I've noticed my gut has a lot to do with being able to think clearly. Well,
Yeah.
sleeping properly long enough and that sort of thing.
Yeah.
And
And there are going to be lots of other things that will affect our memory, whether it's illnesses or medicines, this long COVID now that people talk about after COVID that can kind of affect our brains and how well we can think clearly. And so there'll be lots of other things besides those ones that we mentioned there.
Are you gonna get into these medications that you see on TV, Brain Boost and all that?
You know, there'll be some of them. I have a list of some of these kind of over-the-counter ones that we'll get to.
Okay.
You won't like. There's nothing really that's a magical pill that's gonna return our brains.
It's like the collagens are supposed to be
Yeah.
wonderful.
Yeah, so then number 5, trouble understanding visual images and spatial relationships. So this is that vision problem, problems with balance and reading sometimes can show up. Determining distance, color or contrast, especially problems with driving. And then age-related changes might be vision changes related to cataracts or other retinal problems.
So that means dementia can affect your vision?
Yeah, So any of these types of dementia, and I didn't put it on here, but there's a good picture I saw that shows different parts of the brain that are affected by Alzheimer's dementia, and it's basically all parts of the brain. So it can affect balance and vision and
So can
Yeah.
stress.
what's that?
So can stress.
So can stress, exactly, yeah, other things that can do it too. And then that communication part I was talking about earlier, new problems with words and speaking or writing. So just having a conversation sometimes can be hard, struggle with vocabulary, trouble naming familiar objects or using the wrong name for something. Again, that's sometimes where someone's intellect can slow that being noticed, because they can, if someone has a real big vocabulary, they can just come up with another word. And just, if they can't remember the word car, they'll call it, oh yeah, we used to call it a buggy or something like that. And then they'll just kind of move on and adapt that way. And that's why a lot of times it's the person with you or the spouse that kind of notices some of those.
What about creating new or false memories, but remembering those on the loop? Almost
Yeah.
like it was a dream.
Yeah.
Because it's not actual facts, but they're kind of repeating that over and over,
Right.
and it's not accurate memory, it's a false.
Yeah, I don't know how that happens. I mean, what's happening in the brain that causes that? But yeah, I mean, that definitely could be part of that, just memory loss, kind of not remembering things correctly.
And then are you gonna discuss the differences between Alzheimer's and dementia? Are there so many similarities you're just gonna really talk about?
Yeah, I mean, so as far as the different types, so a lot of those different types that we talked about there, it doesn't really matter,
Because the symptoms are pretty much the
The
same. so you
symptoms are
treat it
pretty much the same, the treatments, there aren't really much as far as treatments that we do for them.
Yeah.
It's more kind of managing and support. So there, some of the medicines that you may have heard of, like Aricept or Namenda, they were actually designed and studied for Alzheimer's, but then we use them for any kind of dementia just with the hope. Because we'd like to think that things are really nice and clean cut like that, but usually with dementias, it's a mixture. There's lots of different things that are going on that are causing that memory loss, and not just one disease there.
So the diagnosis is not really gonna change the treatment or the action plan?
Not
really?
necessarily, right. And in reality, a lot of these diagnoses, we don't really get till post-mortem, till if someone wants to know. Yeah, if someone really wants to know what it is, and sometimes that's important, because then we can pass that information down to our family. And if we know for sure what kind of diagnosis caused this person's dementia, then we can let the family know this is something you need to watch out for. And
That can only be done via autopsy, right?
Autopsy, exactly.
Right, okay.
Yeah. So,
So we can't pass it along.
well, basically you've already passed it along.
Right.
Yeah.
Going home a warning sign or not.
So this is a hard one for everyone, misplacing things, losing the ability to retrace steps. I think that's just about everyone. Becky isn't
Well,
gonna
you
say.
have a button on your key so you can find your car in the morning.
That's right.
What car?
So, and then typical age-related change, misplacing things from time to time, but being able to retrace the steps and find them, even if it takes 4 years. Becky experienced that, each of us.
Not just me, but him as well.
Decreased poor judgment, changes in judgment, decision making, using poor judgment when dealing with money, pay less attention to grooming, keeping themselves clean, and again, typical age related, it's just not affecting your function as much, would be more typical. Withdrawal from work or social activities. This sometimes is something that comes relatively early on when it starts bothering the person, when they realize that they can't remember people's names, and so they just avoid being out in public and going to church and doing different getting around social activities. The other big thing that can be associated with this, just being age related, is hearing. So we've had the ENTs talking about hearing. This is another big reason for withdrawal from social activities. Because if you can't hear what's going on, you just feel left out all the time, so you stop going out and being around people. Changes in mood or personality, again, this is something that other people are going to notice. The person doesn't notice this themselves, but other people are knowing that, they're more irritable, they're getting mad at the grandkids more, or depression, confusion, the suspicious and paranoia is a real common thing that will kind of show up with dementias and memory loss. And then typical age-related changes, developing specific ways of doing things and becoming irritable when that routine is disrupted. So that's just kind of something that happens.
So question, like if the agitation increases as the disease worsens, at what point do you say, maybe do you still get people out and like the communication and activity is good for them? Or do you see a point where they're so agitated that maybe they're not enjoying themselves?
Yeah.
Like at what point do you say, hey, what's best for the person?
Right. I mean, things like safety, and if what that person is wanting to do to function or to get along with life, if it's something that person really wants to do, then there are some medicines that might help bring down that agitation so that they can be around people and go to church and be comfortable and not get that uncomfortable feeling as
Can't
much.
they get my jacket?
But
Can I go get it?
but it
Yeah,
kind of
it's hard.
depends on that function
Yeah.
and what it is that they're wanting to do.
Or sometimes just a short attention span, like being able to do things in short, like maybe
Yeah.
30, 40 minutes, and then they hit that wall, and then they're,
It's not.
yeah.
Yeah. So, good question.
Sorry. Should I go get it now?
So let's see. Yeah, memory difficulty is the most common chief complaint. Patients with dementia also have difficulty with one or more of the following. These are all the things we basically just talked about. Evaluation. Mr. Stallman talked a little bit about this. The first thing is just getting a test. There are lots of tests. A lot of you, whenever you go to your doctor, they may have asked you to remember 3 words, or spell the word world backwards, or count backwards from 100, or different things like that people have used to try to measure your memory and how you're functioning. And those are good because they're scored, and we can do that over time. One that I'm using here in our office practice now is this brain check. I know some of you have done that before, and it's a lot bit more entailed than just remembering some things and counting backwards. It's trying to test all those different things that we talked about here, with the learning, the memory, the language, the executive function, the attention. Obviously, we can't test the social cognition with that test, but it's testing a lot of those different things through different tasks that the test makes you do. And then again, we'll get a score, and then I can look at that and see if it's something we need to be concerned about. But I think most importantly, then we do it again a year later, 6 months later. If the family's saying that they're seeing some changes, then we can test it again and see if that number's going up or going down. So.
Is the actual way to determine if you have Alzheimer's you have to do some type of MRIs or testing of that type?
Not necessarily, so that's what I'm getting to here. So interview with family and informant, again, we talked about that, the informant information is a lot more helpful than the patient themselves. Sometimes labs can be helpful, different vitamin deficiencies can cause memory loss, thyroid, definitely low thyroid is a real common problem with kind of our cognition. Syphilis, there's something that's called neurosyphilis or tertiary syphilis. Even if someone had been exposed to syphilis 50 years before, if that syphilis, it's a parasite, it's a spirochete, stays in our brain, it can cause problems years later. HIV also. So there's some lab tests that we would do. The imaging, possibly a CAT scan or MRI. Those tests aren't to rule in Alzheimer's or different types of dementia. It's more ruling out other things. Did you have a bleed, or did you have a stroke in the past that's causing this? So it's not, the MRI isn't going to say, dementia or the Alzheimer's or anything like that. This second row here, they're trying to develop some of those things. There's some biomarkers that are being developed. This apolipoprotein E epsilon allele. It's a genetic testing that sometimes, if that's positive, it can be an indication that someone has Alzheimer's. Or this PET scan. These amyloid tangles are something that they'll see in brains of people with Alzheimer's. And again, we can't see them until after we do an autopsy and do brain biopsies. But there's a different kind of imaging of our body, this positron emission tomography, with these tracers that sometimes can be an indication that Alzheimer's is there. But again, it's not something we can just go across the street to St. Joe's and do that. It's more kind of in these big tertiary, Houston, Dallas, Mayo Clinic, that they're doing these kind of in research more than anything else. So, but there aren't great tests to do a test or blood test or imaging that will say, yes, you have this, we need to treat you with this regimen or anything like that. Any other questions?
Syphilis, does it cause dementia, or is it just, you think if it comes back,
Right.
does that create dementia?
It can. So again, it can cause memory loss and problems with cognition, just functioning. Usually there are other symptoms besides just losing your memory or being forgetful. A lot of times there are a lot of behavioral issues with that neurosyphilis also. So it's someone who's had syphilis before. So the initial episode of syphilis is called primary syphilis. And then secondary syphilis is usually with their arthritis and joint problems. And then tertiary syphilis is when it can affect the brain. So, Lyme disease does that same thing. It can have a primary, secondary, and tertiary.
You hear, back to my question, you hear about a lot of people having Alzheimer's. I mean, it's so, somebody definitely diagnosed that as Alzheimer's.
Yeah.
You're saying there's no test, there's nothing that can definitely say without any question that it's Alzheimer's.
Right. I mean, unless you do some of these progressive testing or brain biopsy, we can't know without a doubt that it is Alzheimer's. Now there are clues. Usually with Alzheimer's, it's later in age. So usually it's 70s, 80s, 90s that people with Alzheimer's will kind of start showing changes. Some of these other ones, like the neuro or frontal temporal lobe, sometimes it can be earlier, even in our 50s, that people will start showing some of that memory cognition problem. So, but again, yeah, there's no for sure thing. But again, it doesn't, because the treatment it doesn't change the treatment depending on what the diagnosis is. It doesn't really change how we're going to treat that person. We'll do whatever we can to try to help slow the progression and support them and do all the things that we would do, regardless of whether it's frontotemporal lobe or Alzheimer's. I know not a good answer. So what we can do is everything that we've been talking about at these wellness workshops. As I put together this list, it's a lot of stuff that we've been talking about for the past year at these wellness workshops. Just basically living healthy lives. You know, talk about challenging your mind, being curious, reading, taking a class, learning. You know, our brain was designed to learn things and to perform things, learning new skills. Art is always a good thing because it kind of crosses the left and the right brain, which is good. Again, education reduces the risk of cognitive decline, so continuing to try to school your brain and learning things. Moving, regular exercise, especially if you have some of the vascular issues, that movement will help blood flow and get that oxygen to our brain. Protecting your head, wearing a helmet, trying to keep from falling, doing what you can to keep from falling and hitting your head. Not smoking, or if you do smoke, quitting smoking. Both with lung disease, and they say here with the dementia, even quitting smoking will show some improvement in your cognitive function once you quit smoking. So it's never too late to quit smoking. Controlling your blood pressure, managing your diabetes, eating well. I know we've talked a lot about different diets. There's one here that was called the MIND diet, M-I-N-D. It's a Mediterranean DASH intervention for neurodegenerative delay. So the Mediterranean, you guys might a lot know the Mediterranean diet, basically eating like you live in Greece, a lot of olive oil. Yeah, we have a little brochure there that talks about actually both the DASH diet and the Mediterranean diet. The DASH diet, a lot of times we think of that for reducing our blood pressure, but it's basically a combination of that Mediterranean and DASH diet. Maintaining a healthy weight, and then sleep. Sleep is always important for helping our brain health. Looking for sleep apnea. Sleep apnea is another issue that can cause cognition issues if we're waking up every couple of hours whenever we're sleeping. Any questions about any of those?
I'm surprised that stress is not stressed more.
Yeah, I think it is. I mean, I think in general, if you follow these healthy habits, it's helping to manage your stress better. I don't think that we're ever going to be stress-free. I mean, stress is part of living on this earth. So this side of heaven, I think our job is managing stress. It's not avoiding stress. Because even people who live on an island by themselves, there's still going to be that coconut hitting you on the head that's going to stress you out. So, so the goal is not relieving yourself of stress. It's learning how to manage that stress well.
Well, and when Dr. Ridley was here, he said, stress is good. There's good stress. It's when it goes over into the bad stress that it distress. That's right.
That's right.
That it causes problems.
So someone was asking about, let me see if I can make this bigger. Different things that we can do or supplements. You know? So there's a list here of lots of these different supplements that are over the counter. We can get it H-E-B or Walmart or across at Village Foods. And so these first ones here, these people did this huge study with lots of these different supplements, and they found no evidence that, I can't even pronounce that first one, apoaquarin, coenzyme Q10, coffee extracts, L-theanine, omega-3, vitamin B6, B9, or B12 supplement the memory, do anything for our memory at all. Now there was some evidence that for memory benefit with ashwagandha, choline, curcumin, ginger, lion's mane, polyphenols, phosphatidylserine, and turmeric. So those are some that there is some evidence that does have some help as far as our memory. Mixed results on things like ginkgo biloba.
Is there a supplement that wraps all that up into one?
I don't know.
There
That's a
should
lot
be.
of Who gets pill fatigue?
I was kinda gonna ask about one particular one. Prevagen.
Prevagen. Yeah, so Prevagen has been marketed for a while as far as memory loss, and my answer for people whenever they've asked me about Prevagen is I don't know. So with a lot of these, you know, especially if you're going to choose some of these ones that there is some evidence, you know, my typical advice for people, as long as it doesn't cause harm. If it doesn't cause harm for you, like interact with any of your medicines or make your blood pressure go up or anything else like that, or you're allergic to it, if it's not going to cause harm and there's a potential benefit, I mean, why not, you know? And especially if you have that risk, if you know there's a family history of the dementia and Alzheimer's, you know, why not? Turmeric, curcumin and turmeric are two that you hear a lot with lots of different subjects. Turmeric in particular, as far as the anti-inflammatory and joint pains and things like that. But yeah, the vitamin E, vitamin D, ginkgo biloba, carnitine, kind of mixed results. So uncertain is whether there's any benefit from it.
Does that turmeric and
Curcumin.
curcumin come in a pill form?
Mm-hmm.
They do. Turmeric comes. You can just.
Well, it comes with, it's both. It
Capsules.
comes with both.
Capsules or pills?
Mhm.
So you don't have to eat it, you can
Right.
just swallow it.
You don't want to eat it.
Well, they come in
The pills.
bottles at the grocery store too. And my wife brings them on her food.
Yeah.
Yes, I don't wanna eat it.
You can get a big bottle of pills
Just
at
side
Sam's
effects
or
from it.
Costco too,
What's that?
for that turmeric or curcumin. There's a certain brand my
Yeah,
mother-in-law
tea,
likes
or
that
you could just eat Indian
they have there,
food.
so.
You know, go get some Indian food once a week or
That's right.
twice a week.
Twice a week.
Twice
I
Here's some cat.
Or you could make Indian food. You can learn how to make with curry.
Now, is there a difference between, you know, taking these and helping keep yourself healthy and prevention versus treatment and reversal? You know, there's kind of a difference, but I don't know if you start taking this all of a sudden, if it's gonna reverse the damage that's already been done,
Right.
you know?
Again, it's going to depend on what the diagnosis is.
Yeah.
So with Alzheimer's, there are actually problems in the brain, you know, in these tangles that are blocking the neurons. And again, I should have put that picture on there, but a healthy brain is about 3 pounds, about that big, and that Alzheimer's brain is about that big. And so because of all those tangles and, you know, fibers that have formed in the neurons of that Alzheimer's patient, there's probably not reversing it to where it's back to a healthy brain. But with those medicines, the hope is that it will just slow that progression.
I wonder if the tingling and things you're talking about is maybe how some of the false memories are made. I mean, are there just some,
Yeah,
you know, crossovers or something that happens?
yeah. Or maybe they forget what they read in a book and what actually happened to them. You know,
What I
for some-
find strange is not being able to remember the short-term memory, you know, but then having a false memory and repeating that false memory day after day. It's really interesting to me. I
Yeah.
don't know if you've seen that before, but.
Could be a coping mechanism too.
Mhm. Yeah, just so that you have a memory.
But when short-term memory is gone and this new memory has happened, how do you remember that new memory? It's part of the short-term memory. Anyway, strange.
If you had a bad, say, childhood, then you make up a positive
Mhm.
memory in your mind, and that's how you cope with it,
Right.
and that becomes a habit, I think.
Is it safe to say that if you realize your memory is declining, that you don't have dementia?
You know, I would then ask someone.
What's that?
I would then ask someone, if you feel like your memory is declining and you talk to your kids and they say, Dad, you're fine, then I would worry about it less. I would do all these other things to kind of help take care of yourself, and not worry about you developing that dementia. But then when your kids say to you, you know, you're making more mistakes on your checkbook, or you got lost, or maybe we should look into a little bit more, then again, it's that whoever is informing you, just like lots of things, I think we're just bad judges of ourselves, typically because we worry too much about ourselves. One thing I'll just say, my daughter, I have to brag on my kids, our oldest daughter is a nurse, and when she was in nursing school, she worked in a memory unit for a while. And she was working with this one man who had dementia, and she had a project that she had to do to try to help this patient. And so he had traveled a lot, and so she talked to him about, or the family, she talked to the family about all the different places that he had traveled over time. And our oldest daughter is an artist. And so what she did was she went home and she painted all these different things. Like, he had been to India, so she painted the Taj Mahal. And she had been to these other places, and she painted something of that. And then she went back to him with these paintings, and he was flipping through it, and all these memories started coming back into his brain.
And then he was telling her stories about these.
That the family didn't know was still in there, but that because of the stimuli of this artwork, it brought a lot of these things back.
And triggered.
Mm-hmm.
That's pretty neat.
Exactly, yeah.
Now, did I miss something? Is dementia Alzheimer's, or are they two different things?
Yeah, so dementia is the umbrella. Dementia is the overall cognitive decline, basically, and then Alzheimer's is one type of that dementia. Underneath that, right?
Does your brain shrink with dementia, or is it mainly Alzheimer's?
Well, with all of them, I mean, our brain shrinks just with time. So if we look at our brain when we're 15, maybe not 15, maybe 25, and then look at our brain when we're 50, 60, 70, 80, our brain when we're older is always going to be smaller than it was before. The degree of that change in brain is sometimes what can brain size.
Our hats keep getting too big for us.
No, what I use is you shake your head back and forth, and if you can hear it rattle.
Well, if your brain is a muscle, your muscles are all getting smaller too.
Yeah, I know, there is that saying that your brain's a muscle, you have to exercise it. I mean, the brain's not a muscle, like muscles in our heart and our arms and things like that. But I think that exercising is just what we were talking about here. Just ways to challenge it and keep using it. If we don't use it, then it just kind of becomes more stagnant.
Okay, I do a lot of games on my phone just to keep me going. Do a lot of word games, things like that. It helps our brain to stay active.
It does. So it depends on what game. Noah's not going to like this, but Candy Crush I don't think helps our brain.
Okay, that's good.
But
Does
things,
coloring help? Because I like to color on my phone.
I think coloring does too. But it even says here, where did I say that? Oh, it was somewhere else.
Most of mine are word games.
The crossword puzzles, so things like word cookie and trying to remember those words,
Word cookie.
I think helps, or coming up with words. I think crossword puzzles are really good because you have to think of the word, but then there's a context to that word too that you have to kind of put together. Yeah.
I think variety is the key.
Yeah.
To do,
Jeopardy.
because I find I do a lot of word games. I do a lot of word games, but I need to be doing more like coloring and
Yeah.
physical coloring, not just visual things. To make more of those. Yeah, to do more of
Puzzles.
the interconnectedness. Yeah.
I think the other thing we didn't talk about here, but I think social interaction is a big one too, and just practicing that communication. Because then a lot of times if you're not around people, and you don't trust yourself to notice it, then no one's gonna notice that decline. So
I gotta make some friends.
we have to be around people and learn practicing interacting with them and things like that. Well, that is all I have.
That's all you
I
have.
was trying to, these slides, this was supposed to be like one final statement or something like that. So it's not a very good one. I should have asked Becky to come up with something.
Yeah. You. You're the doctor.
So there might be some value in the New Testament in Romans chapter 12, verse 2 talks about retraining your mind. There might be some value there.
Yeah. Definitely. You know, and I think, you know, even with, we're kind of getting away just from dementia, but even with some of those past memories that might be negative, and sometimes that can affect our memory because we don't want to remember those, you know. And so if we do retrain our mind into thinking about and focusing on more positive things or things that we can do or helping other people or heavenly thoughts as opposed to our past, then I think that can definitely will change our outlook. You know, definitely change how we see the world and that perspective.
Well, it changes the chemicals going on,
Yeah.
which affects the chemicals in the brain.
Yeah.
So
The dopamine
Chemical
goes up when we
electrical.
feel good, you know, all of those kinds of things.
So if we do have a loved one who has Alzheimer's and obviously, you know, their memories aren't there, they may say the wrong thing or the wrong name or just say something completely that's not accurate. Do you think it's more loving, you know, just to nod your head and not try to correct them? Because they don't understand or know that they're saying the wrong thing, you know? If it's not harmful,
Right.
just to be like, oh, really, is that right? Knowing that it's,
Yeah.
you know,
I
not
think-
quite true.
You know, there sometimes if people's memory, if it doesn't matter to them whether they have the correct memory or not, then I agree. Just kind of move on, smile and nod.
Yeah.
But if they're frustrated, if they know, if there's something in it that says, I don't think this is right,
Trying to help.
then maybe correcting that memory and then or retraining it or going back and showing pictures or videos of that event might help them to kind of correct that memory. If they don't know any better, especially if they're sometimes they can get adamant that this is correct, and then if you try to correct them, then they become angry, then it's probably
Just
not
leave
worth
it, yeah,
it's
just say,
not-
just okay.
Yeah.
Has there been any studies on genetics as related to mental diseases?
So dementia or mental diseases?
Well, either one.
Yeah. You know, there are always studies on those. It's hard to determine because it's always both and. But one, you know, it's always some genetics, some environment, some exposure or different things like that over time. You know, but with a lot of these, especially the neurodegenerative dementias, there is some genetic component to it, whether it's congenital, like you inherit it from your family, or something that your brain was born with. It's hard to determine.
It's really an evolving technology, genetics and the relation of our genes to diseases and cancer and everything.
It is.
It's amazing what's being done to correlate that.
Yeah, that's one problem, like this genetic testing for this apolipoprotein E epsilon thing, this allele problem. The problem with gene testing, because you know we've mapped the whole genome now, so we should be able to know things that we can do. You can swab your cheek and send it in the mail, and they'll tell you where you're from and who you're related to. The problem is if you have that gene, that doesn't mean it's going to be turned on. So, you know, sometimes they'll do twin studies, which can be helpful with genetics, because you can have that gene and it never be turned on, and you'll never develop that problem. Or someone can have that gene and something will happen and it'll be turned on, and you'll develop that problem. But we don't know who it's going to be turned on for and who it's not.
Can anesthesia cause a forgetfulness?
Yeah.
I mean, people who have had surgery, especially later in life, they then seem to have a short-term memory loss.
Yeah.
I noticed that with the great aunt, that she at 90, I think, had heart surgery, and after that, she would repeat herself, which before, I mean, she was a very smart lady before,
I mean, it could be related to the medicine. Typically, usually most of those anesthesias, there is some degree of amnesia that they want, so that you don't remember what was going on during the surgery. But typically typically those medicines wear off and then it goes away. But with any kind of surgery like that, there's always a risk of a period of not getting oxygen to your brain, so that anoxia can definitely cause problems with dementia if your brain's not getting oxygen for a short time, or so. Okay.
Sometimes it takes a long time to get all that medicine out of your system.
Well,
You know, you'll see some of those side effects for months.
but if it continues.
Yeah, if it stays for a long time.
A year, maybe.
Any more questions?
Any questions for Noah?
So we said it's 6. And it's 6 o'clock.
The test that you have,
Oh,
that you're
yes.
talking about, how long does that take and what's involved?
Yeah, so it's real simple. It takes about 15 minutes.
10 to 15.
15 minutes. And you just sit with the iPad. And you guys, if you ever want to do it, just give us a call or text us and we'll set up a time. Becky or Nancy or I can kind of get you set up in a quiet room when Noah's not around.
We'll all be here tomorrow.
It's not painful.
It's not painful, no needles or anything like that. But there is the memory, so that some of it is recalling things. They'll give you some words to remember, but then a lot of it is tasks to do on the iPad. So all you do is you just look at the iPad and you just punch buttons on the iPad, and they've studied it. There's lots of research that's gone into this test. I couldn't explain how it all works and what it's testing, but it seems to do pretty well. But I think from doing it for a while, I think it's going to be more helpful the more times we do the test, the more times one does the test. There's a learning curve to it too, because it's sometimes a little bit tricky knowing what task you're supposed to be doing.
Yeah.
And so,
Or if you're nervous.
exactly.
It's a timed thing?
It's not timed. Speed is a part of it, so how long it takes you to react to do the test, they consider that. That's kind of why it's computerized. They can consider that in how long your reaction time is. If it takes you 5 seconds as opposed to 1 second to push a button, then that will have something to do with your score. But there's no time limit.
So it comes up with a score?
Yep. And then we'll put that score on your chart, and then we'll do it again at a later time. Usually at least 6 months, 6 to 12 months later.
I do it several times a day for months. And I get a good average, right? A good trend.
Yeah, well, you're really good at it.
It's really not a bad idea, because it should still, if someone does have dementia, no matter how many times you practice and you learn, it should still distinguish that and show up as a deficit on the score. Now, your score might get better, but then it'll just kind of taper out, and that's going to be your score. So if you want to come in every day and do it.
That way I know what day it is. So.
The other thing we could do with the test is if anyone wants me to, I can email it to you, email a link to you, and you can do it at home. So if you want, just don't have your granddaughter do it or something.
Don't show Carrie that, she'll want you to email it to her.
So
I'm not sure everybody else would feel the same way, but I felt reassured after
Me too.
he administered the test with me.
Me too. It helped. It helped, you helped clarify that it is, because some of the things I'm going through is just my age. You know, that helped me a lot. I don't know if it helped them, but it helped me a lot. Gave me a little bit of peace, but.
Well, he didn't tell me I was beyond help, but I felt like it.
Right.
all right, yes.
I understand these presentations are on record, one can.
They are, yeah.
And I
We
need to know
will-
how to do that again.
We'll email you a link
Okay.
to our YouTube channel.
Yeah, I never got one. I need one.
I know, I think nobody got it.
Okay.
Yeah, I didn't
It might be because of his dementia.
Do not tell us he's got the dementia. Some of us thrive on this.
You gotta keep that to
No,
yourself.
we'll make sure you guys get a link this week.
Is it out on your website?
It is
It's
on the
on, we have
website.
it, it's on the website. There's a link on our website.
Okay, I didn't know that.
Just have to remember to go look at it.
So
So-
if you look at the website,
Email is better because it's right there.
it's right here, the YouTube button,
Oh,
Can you
wow.
click on it?
How easy
That's what
is
that
that?
is, YouTube.
and there's
Oh, wow, that's easy. Forget it.
We
We
don't,
had
we
it
don't
all
have
the time.
YouTube.
We should do.
Yeah.
there they are.
Well, it's ju- you just,
That
it
still
goes,
takes you
it,
to it.
it will pull it up on, just online, on your
Oh,
browser.
okay.
Yeah. So, and then you can watch any of the ones we have up there. Some of them we don't have, but we do have quite a few.
Cool.
Yeah, so you can always look at these. Our daughter Rachel, the artist, she manages our Instagram. Oh, see, I think you have to have an Instagram account to open it, don't you?
Yeah,
Probably.
but
How
But
is
your
that?
Google, you can log in.
To open your Instagram, to open your website?
No, to look
No.
at the Instagram. But I
Yeah.
don't have
Oh, yeah.
Instagram, so yeah.
It's, oh, it's not YouTube,
But it'll
it's
open with
Instagram?
Facebook.
no,
We
You
did
can
look
open with
at
there's
You can open with
Instagram,
Facebook, yeah.
Facebook.
No, I need to open your
Okay.
Instagram and use
Oh,
Facebook's
Facebook.
account to get
Yeah.
it.
See, I don't have a Facebook account either.
Oh, good for you.
But yeah,
So
so
you
from
can
the
get it on Instagram, YouTube.
the videos just are on YouTube.
Just on YouTube.
But if you go to the bottom part of our front page of the website, there's the YouTube button.
Oh,
Do you have to have a YouTube
No.
account?
No,
No, it'll just come up.
it'll just
And
pull
you don't
up.
have to
We don't
download
have
the
any
app.
of those.
Yeah, that's fine.
Do not download the app.